Good afternoon, everyone. Before we start today, I want to just first send my very best to Governor Hogan upon his news and let him know that we all in Baltimore County are wishing for a full and speedy recovery. And I want to just personally thank him for being a governor who is pushing the importance of the vaccine. And I think that his news today reinforces that, the importance of getting your vaccination and getting your booster. Today I'm joined by health and hospital leaders from across the Baltimore region, including our own Baltimore County Health Officer, Dr. Gregory Branch, Baltimore City Health Commissioner, Dr. Letitia Jaraza, Craig Carmichael, who's president of the Northwest Hospital, Dr. John Chassar, president of GBMC, Dr. Gail Cunningham, Chief Medical Officer of St. Joe's, and Dr. Stu Levine, who is president of Franklin Square. I want to first thank them and their teams for the incredible work that they have been doing throughout this pandemic. Their doctors, nurses, and other health professionals have consistently gone above and beyond to meet the needs of all our residents, and we are so grateful for them and what their teams do every day. Today we gather to sound the alarm. Across the world, COVID-19 cases are rising sharply as the Omicron variant spreads exponentially. We in the Baltimore area and here in Maryland are also starting to feel the pain of these sharp rises in cases. And while we don't currently have access to state data, the drastic increase we're seeing in all of our hospitals across Maryland tells us that we're at the beginning of what is shaping up to be a very troubling winter spike. Last week, as part of our ongoing dialogue with these health professionals, I spoke with our regional hospital leaders about rising COVID-19 hospitalizations in Baltimore County. What I heard from them is that the situation is dire. Our hospitals are already nearing capacity, and we have limited ability to expand the number of beds, not for lack of space, but because we need medical professionals to staff these beds. And finding that help has become increasingly difficult. Our healthcare heroes are exhausted. Emergency departments are full, and hospitals and ICUs are filling up quickly. Alarmingly, there are only 14 staffed ICU beds currently available in Baltimore County. And the worst is likely still to come. Just yesterday, the governor confirmed what our frontline healthcare workers already know. As he said, over the next 3 to 5 weeks, we anticipate probably the worst surge our hospitals have been throughout this entire crisis. Indeed, with the holiday season underway, and with so many people expected to gather in the coming weeks, these and other healthcare leaders continue to tell me that they are gravely concerned about what January will look like. Now is not the time to let our guard down. We might be done with COVID, but COVID is most surely not done with us. With Christmas now just a few days away, the best way to protect our loved ones and to fight the spread of this variant is to wear a mask, get vaccinated, and get boosted. Because being vaccinated without a booster may no longer be enough. Think about it this way during the holiday season. If you're not boosted, you're not vaccinated. And if you're not vaccinated, you continue to put your life in jeopardy. While breakthrough cases are possible, we know, and the data confirms, that unvaccinated individuals are driving this increase in hospitalizations. It's time to put ideological concerns aside. It's time to do our part to protect our community this winter. It's time to cut through the misinformation and lies about the effectiveness and the safety of vaccines and masks. Please, 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 get your vaccine and get your booster today. In Baltimore County, about 600,000 of our residents are currently vaccinated. It's about 73% of our population. But we know that not every eligible resident has a booster who can get one. The Pfizer vaccine for children 5 to 11 remains available at all of our vaccination clinics. First and second doses of both Pfizer and Moderna are also available to individuals 12 and over. And boosters are available to all residents 16 and over. You don't need an appointment, and shots remain plentiful. Please do your part to save your life and the lives of others. Help us put this pandemic behind us. If you need a vaccine or booster, visit baltimorecountymd.gov/vaccine to find a clinic that works for you. I think it's important that you hear directly from our healthcare providers about what's happening on the front lines, so our residents do take this seriously. So with that, I'd like to first turn the program over to Dr. Gregory Branch, Baltimore County's health lead.
Good day, everyone. And as the county executive just shared, COVID-19 is continuing to have a major impact across Baltimore County and the state. But we can change that. This is different from March of last year. Why? Because now we have the tools to prevent unnecessary hospitalizations and deaths. Now we have the ability to ensure that everyone can get tested, vaccinated, and boosted. Get tested if you're symptomatic or if you've been in close contact with someone who's tested positive. Get vaccinated if you have not done so yet. We now have vaccines for everyone age 5 and up. And it's been 6 months, and if it's been 6 months since you were vaccinated with Pfizer or Moderna, or 2 months since you've been received the J&J vaccine, then go get boosted. The Omicron variant is extremely contagious and becoming more dominant among confirmed cases of the virus. And in order to weaken the impact of COVID-19, all eligible individuals must get tested when necessary, vaccinated right away, and boosted when eligible. I'd like to take this opportunity to recognize my good friend and colleague, the Baltimore City Health Commissioner, Dr. Letitia Underaza. We've been working together tirelessly on the battlefield to address this public health emergency in an effort to keep our neighboring hospitals from becoming overwhelmed. I'd like to thank our hospital partners who are also with us here today, and you will hear from them in a moment. In addition, our pharmacies and our private physicians are also providing vaccines and testing services. We must avail ourselves of these resources wherever possible. In the wake of this more contagious variant, I have to remind everyone to revisit the all-important 3 W's. Wear your masks. Omicron is very contagious. Wear your mask and be sure to wear it correctly. Wear it around your nose and your mouth with a tightly, not under your nose. Watch your distance. With the holidays here, people want to gather and celebrate. Please, please, please avoid large gatherings. Intimate gatherings amongst our family and friends who are vaccinated and boosted is much, much safer. And always remember to wash your hands. In addition to COVID, this is also cold and flu season. Regularly wash your hands will help stop the spread of some of these different germs. We know that these 3 W's can make a difference. So in closing, during a time when we are traditionally trying to come up with last-minute gifts ideas, the choice is simple this year. If you have not already done so, give your family and friends the life-saving gift of your vaccination. If a loved one that you know is not yet vaccinated, encourage them to give you the life-saving gift of vaccination. Let them know it's free, it's safe, and it could be the difference between life and death. Do it for yourself, your family, do it for the community. Thank you. Dr. DeRosa.
Good afternoon. As stated, my name is Dr. Letitia DeRosa, and I am the Commissioner of Health for Baltimore City. I bring greetings today on behalf of Baltimore Mayor Brandon Scott. I want to begin by thanking County Executive Olszewski for his leadership throughout this pandemic. I want to thank my colleague, Dr. Branch, for his tireless commitment to the service and support of residents here in Baltimore County. And I also want to thank and acknowledge the healthcare executives here today who are bringing light to this dire situation we find ourselves in regionally. I appreciate this opportunity to stand alongside our neighbors here in Baltimore County because we all know that this disease doesn't care about city-county borders. While we still lack access to some of the COVID-19 case data locally, we know hospitalizations are on a very dangerous trajectory. We also know that hospitalizations are a lagging indicator of how we're doing against this disease. What is particularly concerning is that we're heading into the winter months in the midst of a bustling holiday season with a highly transmissible variant circulating locally and globally. Now more than ever, it is critical that we utilize all the tools in our tool belt to help in this pandemic. While we see breakthrough infections occurring, we know that this disease is still largely ravaging our unvaccinated population. So it is critical that if you aren't vaccinated, you get your first dose as soon as possible. If you're due for your second dose, get that immediately. And if you're eligible to get boosted, get that booster dose as soon as possible. While vaccination certainly is the primary tool we have in this battle, early testing leading to diagnosis and subsequent quarantine and isolation remains another critical way that we can all slow the spread of this disease. If you're experiencing symptoms or have been exposed to someone with symptoms, get tested immediately and wait for your results prior to interacting with others. Please quarantine or isolate appropriately so that you don't unintentionally infect others, especially those that are most vulnerable among us, such as unvaccinated children, older adults, or immunocompromised individuals. Please let this be a reminder. We are still in this fight, but we can win this together. In order to do this, we have to get vaccinated, get boosted, get tested, stay masked, stay distanced, and stay safe. Thank you and happy holidays. I'd now like to turn it over to my colleague, Mr. Carmichael.
Thank you, Mr. County Executive, for bringing us together and in the quick action from our discussion on Friday. We're here this afternoon. This is a call to action for the greater Baltimore community that knows no boundaries. All of the hospitals in the area are facing critical nursing and staffing shortages. All of our 23 facilities around the Baltimore region are at capacity or near capacity. At Northwest Hospital and at LifeBridge Health, we've seen a threefold increase in our COVID positive cases since November. Our frontline nurses, our techs, our respiratory therapists, they're fatigued. They're tired of yet another round. We are now entering 20 months. One ICU nurse told me that she just doesn't know if she can go another round. We've heard that from so many of our caregivers. They're tired, they're fatigued. One recent family visited our emergency department. All 3 adults in the family came in. All 3 were admitted. All 3 had COVID, and all 3 were unvaccinated. The husband was discharged. However, the mother and the daughter still remain within our ICU and are on a vent. Our COVID patients ask, can we get a vaccine when they're in the hospital? Our simple answer, it's too late. At Northwest on Saturday, 80% of our COVID positive patients were unvaccinated. On Sunday, it was 90%. Our ask of the greater Baltimore community is get vaccinated, get your booster, wear a mask, socially distance, and as we approach the holidays, please be cautious, please use good judgment. We're all in this together, but we want to make sure as we enter January that we have the capacity to care for each of you and your loved ones in a safe manner. I'd now like to introduce Dr. Gail Cunningham, Senior Vice President and Chief Medical Officer at the University of Maryland St. Joe's Medical Center.
Thank you. Thank you very much. Really appreciate being able to be here. You know, we're in a very different place than we were 20 months ago. 20 months ago when this pandemic struck, we had a very robust workforce with a lot of energy. Now we have a very diminished workforce in healthcare. We're seeing 30 to 40% vacancy rates across our hospitals. So there simply aren't enough people to take care of all the people who are coming in. And the people who have remained, as has been mentioned, are exhausted. They're being asked to work extra hours, overtime, pull extra shifts. They're exhausted, and they have their own issues with their own family stressors related to COVID. So this has really become a health crisis in Maryland. I'm an emergency medicine physician by background, so I'm very close to the my colleagues in the ER. My daughter is a nurse at St. Joe's in the emergency department, and they are so defeated when they see person after person who's unvaccinated coming in, now begging for treatment. The other thing to appreciate is that this is not just a COVID issue anymore. This is now affecting all kinds of healthcare. The waits in the ER, after 30 years of being in the ER, I've never seen waits like we're seeing right now. 8, 10, 12, 14-hour waits to be seen for non-COVID problems and COVID problems. So the impact is enormous. So I would just beg the same that everybody else has begged, that everybody get vaccinated, get your boosters, wear your masks. I would recommend mandating masks again across the county and the city, really, really important. Keep social distancing and not use our emergency departments for minor problems. Use urgent care, call your doctor, but our emergency departments are really for the severely ill, critically ill. They're overwhelmed and that needs to be recognized. Thank you. I'll now turn it over to Dr. Tashar from GBMC.
Thanks, Gail. Well, I don't want to sound like a broken record, but the message is exactly the same. We have 35 COVID-19 positive patients at GBMC right now, and the overwhelming majority of them have not been vaccinated. So I would ask the citizens of the county and the region to be a part of the solution and not a part of the problem. If you have not been vaccinated, frankly, you are a part of the problem, and you do not want to be a part of the problem that leads to your friend, your neighbor, or your loved one not getting the timely evidence-based care that we are used to giving because we are overwhelmed by people who have not done the right thing. So again, we recognize that everyone is so tired of this, but please continue to do all the things that will minimize the probability that we continue to spread the virus from person to person so we can get out of this and get back closer to what we remember as a normal life. Thank you very much. And now let me turn it over to my friend and colleague, Dr. Stu Levine from Franklin Square Medical Center.
Thanks so much, Dr. Chisar. And thank you, Mr. County Executive, for inviting me to join you today with such a distinguished group. And thank you for your leadership and support of our hospitals throughout the pandemic. Thank you as well to Dr. Branch and Dr. DeRaza for your leadership. Well, this is not where we thought we'd be in December of 2021. Rising hospitalizations, overcrowded emergency departments and urgent care centers, intermediate and intensive care units filling up with critically ill COVID patients. A year following the introduction of some of the most highly effective and safest vaccines ever produced, we are once again experiencing a significant COVID surge, driven by new and highly infectious variants, Delta and Omicron. And while it is true that even the most fully vaccinated and boosted among us may be susceptible to breakthrough infections, infections in this group are usually mild, self-limited, and infrequently lead to severe illness, hospitalization, and death. Make no mistake, the overwhelming proportion of patients with COVID now being admitted to the hospital and to our ICUs are those members of our community who have thus far chosen not to receive a COVID vaccine. To our exhausted healthcare workers, this is the surge that didn't need to happen and can be blunted if everyone in our community does its part. Get vaccinated, get a booster, and continue to wear masks in indoor spaces, especially over the holidays. Amidst our Franklin Square Medical Center, we have cared for and discharged nearly 3,000 COVID patients home to their families. To the compassionate caregivers who have accomplished these amazing feats, these patients aren't numbers. Each is a person with a name, a family, a life, and they are tired of watching these patients struggle to breathe, decompensate, and yes, sometimes die, day after day, and now year after year. The toll it is taking on them is incalculable. I recently asked one of our nurses in our intermediate care unit how she was doing, and she replied, "It's heavy, Dr. Levine. It's heavy." We are currently operating at near full capacity every day, and the patients we are seeing are sicker than ever. Please remember our courageous healthcare workers during this holiday season and get vaccinated. Please. Mr. County Executive.
Questions?
Are you worried that the Maryland Health Department hasn't published recent COVID cases? That they're still behind on publishing that data?
Yeah, clearly, we value our partnership with the health department, and the more data we have, the easier it is for Dr. B and Dr. D to do their part for our partnerships with the hospital. So the more information we have, the better. But we're focused in terms of what's in front of us. We don't know the case rates because we don't have that data, but we do know the hospitalization rates. We do know how many people are in the ICU, and we do know how many people are still unvaccinated, and that's what we're trying to address today.
Have they given you any indication of when those numbers might be back online or might be available?
I'm going to turn that over to the health officers and see if they have any answers for that one.
At this particular time, we do not know when all those numbers will be coming in. Obviously, we can utilize those numbers to give us specific information, especially regarding our particular jurisdictions and where we have to focus. At this particular time, we would love to have those numbers. We don't have those numbers, but be rest assured that we have been moving forward and we are continuing to fight this epidemic.
But county testing sites are still reporting to the state, I'm guessing, all their positive cases. Is that correct?
Exactly. So we continue to report what we need to report to the state. We're not getting a lot of that information back in any type of aggregate form, and we're waiting for that. But we're going to continue to do our testing. We're going to continue to do the vaccinations, and we're going to continue to boost people.
So the state is still collecting data, just not making it publicly available?
Exactly.
Thank you all.
Thanks, everybody.
Docs, plural, thank you all.
Thank you.